Hello dear viewer, thank you for tuning in to this program that is brought to you by Capuchin TV in conjunction with Mater Misericordia Hospital. This is just to inform you when it comes to matters concerning your health, and that's why we have this program lined up for you, to inform you and to educate you. Today we're going to be talking about prostate cancer. In the studio we have a beautiful lady. She is going to be introducing herself. She is from Mater Misericordia Hospital and she will tell us what does she do in Mater Misericordia Hospital. Hi doctor.
Hi, thank you very much.
Good to see you.
Thank you.
Welcome to Capuchin.
Thank you very much.
Tell our viewers what is your name and what you do in Mater Misericordia Hospital.
Yeah, so my name is Dr. Joyce Cheke. I am a general surgery resident based at the main hospital, the Mater Misericordia Hospital. I'm currently training for surgery under the COSEXA program. So COSEXA is an acronym that stands for College of Surgeons of East and Central Africa. So basically it's a professional body that's mandated to train surgeons or postgraduate students. It's a second or rather Mater Hospital is one of the centers that's based in Kenya.
Wow. And amazing. Welcome. Thank you, Dr. Joyce. Welcome. And today we're going to be talking about prostate cancer. What does it mean, or what is it all about prostate cancer?
So I think first we may start by defining what the prostate gland is for the viewers. So the prostate gland is a male reproductive gland, one of them, that's located within the pelvis. It's a size, normally it's the size of a golf ball, which is around 20 to 35 centimeters cubed. The prostate gland is located just below the urinary bladder, which is a chamber that stores urine, and it also encircles the urethra, which is a tube-like structure that facilitates passage of urine. So cancer is a word I think many of us have heard before, but just to make it simple, it's abnormal growth of cells. So when abnormal growth of cells, it can happen anywhere in the body, but when it happens in the prostate gland, that's when we say the patient has prostate cancer. Yeah, and I think it's important to emphasize that it's only found in males.
Yeah, sure.
Yeah, the prostate gland is only in men. And this cancer is more common in the aging male. So as they grow older, that's when men are more likely to be diagnosed with prostate cancer.
We talked about the age. What age? Is it 45, 50, 60? So to specify that.
Okay, so from the age of 40 going onwards, the likelihood of being diagnosed with prostate cancer increases. However, the sub-age of 65 is around the age in which prostate cancer is most commonly found. So from the age of 40, as we shall discuss later on, amongst our population is when the likelihood or the risk of prostate cancer
another risk is your
ethnicity. And in the United States of America, prostate cancer is the second cancer that after the skin cancer. What do you have to talk about how common is it, especially when we talk about in Kenya?
So some studies have shown, as you've said, in the States that it's a second leading, or rather globally, not just in America, it's a second leading cause of cancer amongst men. And just to correct you, it's second to lung cancer. And worldwide, it's a fifth most common cancer amongst the general population. That's why, but in Kenya, as you've asked, it's a third most common cancer, and this is after breast cancer and cervical cancer. In terms of Kenya, it's the most common cancer amongst aging men. So that's the statistics that are found in Kenya. Just to put it simply, 1 in every 10 males will be diagnosed with prostate cancer within their lifetime. So just to show you how common that the cancer is, especially amongst prostate cancer is common. The male, so if your dad, if your granddad, yeah.
Okay, and what are some of the factors that are developing prostate cancer?
So there are many risks that are being associated with being diagnosed with prostate cancer. I think I'll just talk about a few. As I've mentioned, being male is a risk factor in itself, and being a man and aging man is one of the most common risk factors. So the reason for this is not known. However, as you grow older, your prostate gland increases in size, and we think that the reason for this is the hormonal changes that occur in the man as they grow older, and this is mostly after the age of 40 years. So after 40 years, the size of your prostate becomes larger than the normal size, as I had said, which is around a golf ball size, which is 20 to 30 centimeters. Centimeters cubed, rather. That's the volume. So being a man and being an older man predisposes you to getting prostate cancer. Another risk is your ethnicity. If you're black African, black American, the chances of you being diagnosed with prostate cancer is higher than the general population. The reason for this again, the reason for this again is not known. But some studies have shown that in this population of people, the levels of testosterone are higher, and we've said testosterone is associated with an enlarging prostate. So blacks tend to have higher baseline levels of testosterone, and that's why their age of diagnosis is younger than the general population. And as we shall see later on, we tend to screen these people earlier, around the age of 40, unlike their Caucasian counterparts, whereby we will begin screening maybe around the age of 50 years. Yeah. So that's another risk factor, your ethnicity. If you're black, if you're an aging man, the risk of getting prostate cancer is high. Also, there are some families that prostate cancer is common. So if your dad, if your granddad, if your uncle or your first degree cousin has been diagnosed with prostate cancer or has succumbed to the disease, you have a higher chance of being diagnosed with prostate cancer, unlike the general population. Even some people whose mothers, aunties have breast cancer or endometrial cancer, for example, the likelihood of them being diagnosed with prostate cancer is higher than the general population. Yeah, so I know it can be a bit scary if you're a man, if you're black, and if you have a family history of prostate cancer. So I'm not saying if you have all these risks that you will automatically be diagnosed with prostate cancer. I'm just saying that your risks are higher and you should be more vigilant to seek screening at your nearest facility. Also, it doesn't mean that if you have no, if you don't have a positive family history, or if you are Caucasian, for example, it doesn't mean that you will not get prostate cancer. It just means that maybe we will start screening you later than the black population. So these are just some of the things.
Okay, that's very interesting. Yeah, so maybe where does it have to worry about? Maybe they have a family history, or you are at the age of 40, so you just start worrying that you might have a prostate cancer.
Yeah, you shouldn't have anxiety about it. What you should do is just go to your nearest health facility and have a prostate health check to see whether, to be followed up subsequently to see whether you have the disease.
Okay, and what are some of the common signs and symptoms of prostate cancer?
So there are no specific signs or symptoms of prostate cancer. It doesn't mean if a patient comes with symptom X, it automatically means that they have prostate cancer. But there are some symptoms that a patient may present with that will make the clinician suspicious that they may have a prostate disease. Yeah? So these diseases are urinary symptoms. Remember I had said earlier the prostate goes around the urethra, which is a tube that allows passage of urine. So when the prostate increases in size, it affects this tube. Yeah? So the patient will have issues with urination. So some of the things that the patient may come with is they complain that they go to the bathroom more frequently than usual. Their partner, or even then, they may notice at night they wake up more frequently to go and urinate. Like for example, if they used to go 3 times, and then when their prostate enlarges, now they are going 6, 7 times at night. They're waking up to go to urinate. So this will give you an idea that there's something wrong with your prostate gland. Yeah. Another thing is when you're visiting a urinal, the male patient, they'll have to move closer to the urinal to urinate. And like before, maybe they were a bit further because their urine stream is weaker.
So the prostate gland is very close.
So the stream of urine doesn't go the distance as it did before. Another thing is when they're urinating, they feel like they have to strain to urinate. And if you think about it, it's like the prostate is inhibiting this pipe of urine flow. So it's like you have to push so that the urine can come out.
Basically what it is.
So these are just some of the symptoms that the patient may have. As I said, prostate cancer is cancer cells, and cancer cells spread to other areas of the body. And the most common areas in which the prostate cancer cells spread is the back. Yeah? So if they spread to the back, the patient will have back pain. If they spread to the lungs, to the bloodstream, they'll have a cough. And sometimes they can even spread to the brain. And this now, the patient will have a headache, and this headache isn't able to be treated by painkillers. They may also have visual changes, just amongst other things. Another common symptom is they lose weight, and the weight is usually unexplained. It's not as a result of exercise or diet, it's unexplained weight loss. Yeah. But majority of prostate cancer is asymptomatic. So most patients who come do not have symptoms of prostate cancer, and most of them we pick up when they come for their regular checkups, and that's when we pick that they have prostate cancer.
Okay. Then I think we should be talking more about the screening part. It's very important for any male person to go and be screened just to know yourself, right?
Yes.
Okay, and how is prostate cancer diagnosed?
So as I had said earlier, there are some symptoms you present with. So once you present with these symptoms, you go to your doctor, and the doctor will perform, or rather will ask you a set of questions, what we call history taking. So once they've taken a history of the symptoms that you may have, they move on now to a physical examination. So what's special about the physical examination for the prostate is we do something called a digital rectal examination. I know it might sound a bit green to some people, but it's not actually. So the prostate gland is very close to the rectum. So we tend to examine the prostate through the rectum with our fingers. And the purpose of this is to evaluate the size of the prostate and to check for any nodules that the patient may have. Another test that is usually done to help us diagnose the patient is something called a prostate-specific antigen. So this is a blood test. Basically what it is it's a protein that's produced by the prostate gland. Yeah? So all men have this and they increase from PSA, as we call it, within the blood. Yeah? However, if you have cancer, the level of this is a bit higher. I think here is where I think I should emphasize to the viewers that the interpretation of this test is usually by the doctor, and it shouldn't be interpreted by the patient themselves, because you can go to any lab and have a test done, and it may become high, and you will become anxious, and you think that you have prostate cancer. But there are many other things that cause an increase in this test. Yeah? So it's very important that it's interpreted by a qualified doctor, so that you don't misdiagnose yourself. Then after you've done a history, a physical examination, and you've done the blood test, the doctor may perform what is called an ultrasound of the prostate. So this ultrasound will give you more details than was acquired from the physical examination. Through this ultrasound, you can also be able to take a biopsy of the prostate. And once you take a biopsy of the prostate, the biopsy is taken to a doctor called a pathologist. So a pathologist is a doctor who looks at cells of the body through a microscope. So once they look at these cells through the microscope, that's when they can definitively say whether you have
So there's
cancer
no
or not.
specific way.
So prior to that, you cannot say that someone has cancer or not. You can maybe be suspicious, but it's not a definitive
So
diagnosis.
if you're a smoker, for example,
So these are some of the ways in which the doctor stages.
alcohol intake.
So through the biopsy, that's when you can be able to grade the type of cancer that the patient has, whether it's slow growing or fast growing. And then from there on, you can now make tailored management plan for
even
the patient
foods and
with regards to the cancer.
Okay.
Yeah.
You talked about PSA.
Yes.
I think it's very nice if you can say what does it stand for. Maybe I'll be asking themselves. What does PSA mean?
Okay, so PSA stands for prostate specific antigen. So as I had said earlier, it's a protein that's produced by the prostate gland. And if you have a prostate gland, you will have this PSA in your body. Yeah? However, when you have cancer, the levels tend to increase. And they increase depending on the age of the patient. So for example, a patient who's around the age of 40 to 50 has a different PSA level than a patient who's 65 to 70. Yeah? So from a baseline PSA is taken, and if the patient has no other factors that can increase this level, for example, if a patient has a urinary tract infection, sometimes this causes the PSA to elevate. So the doctor will tend to do a second PSA level over a time span of a few weeks. So we compare these baseline levels to evaluate whether the patient is likely to have prostate cancer or not. And this is usually interpreted by the doctor. Yeah. Certain PSA levels don't equal prostate cancer. As I said, the only definitive way to confirm that a patient has cancer or not is through the biopsy. Mm-hmm. Yeah. I don't know if that's clear.
Yeah, I think that's very clear for all of us, even to our viewer.
Okay.
And before I think we take a break, is there a way of preventing developing prostate cancer?
So there's no specific way of preventing prostate cancer. However, there are ways in which you can improve the health of your prostate. Yeah. So if you're a smoker, for example, we would encourage you to stop smoking. Alcohol intake should be taken in moderation. There are certain foods, for example, that are rich in lycopene, like tomatoes, mangoes, and watermelons, which is an antioxidant that has been shown to reduce the risk of prostate cancer. Even foods and fruits rich in vitamin D, vitamin A, like spinach, for example, or the legumes, have been shown also to reduce the risk of prostate cancer. In terms of the younger men, sexual health is very important. Avoiding situations in which you may get sexually transmitted infections that may later predispose you to acquiring the prostate cancer. Mm-hmm. Yeah. So those are just some of the ways in which you can improve your prostate health, but there's no specific way of preventing prostate cancer.
Okay.
Yeah.
Okay, very important.
Yeah.
I think we're going to continue from that, but before we're going to take a very short break, and this is Health Talk with Dr. Joyce Chege from Mater Misericordia Hospital. My name is Maureen Kimani. Stay tuned.
Mater Hospital welcomes you to its newest satellite medical center at the Well Mall along Langata Road in Karen.
The reason why clients should come to Mater Karen Clinic or Medical Center is because we offer a variety of medical services, to include consultation services which are done by our qualified and experienced doctors.
We manifest the Spirit of Christ in the provision of healthcare to all our patients as we adhere to the values of the Religious Sisters of Mercy.
We provide basically primary healthcare services. So this means we'll follow up patients on an outpatient basis for various diseases, including diabetes, asthma, and any other illness which arises, which does not require complex care. Our staff are qualified and provide effective services which are cost effective and good for our patients.
The various services that we offer at our clinic include pharmacy services, where we have a fully stocked pharmacy run by a qualified pharmacist, and we serve all your prescription needs. We have laboratory services that are run by our qualified lab technologists.
Get more than just basic treatment at Mater Hospital Karen Medical Clinic.
One of the key features of primary care is that we provide health education about various conditions. This would include things like hypertension. We would advise you on things such as how to take care of your health.
We serve our clients within a very short time. We have enough well-ventilated waiting area for our clients. And we have rooms for all those procedures that we've mentioned, well-spaced rooms with enough facilities and equipment. We also have all the decentralized services that are offered from the main hospital, to include ultrasound services that we offer on Wednesdays from 8 a.m. to 5 p.m. in the evening. So feel welcome to Mater Misericordia Hospital, Karen Medical Center.
We take pride in your wholesome well-being. We are always ready to meet you at your point of need.
A lot of health issues are now preventable, and this means that just by making lifestyle changes, we can improve the health of people in the community.
Our esteemed clients and patients, welcome to the Mater Misericordia Hospital, Karen Medical Center.
We have a large, well-ventilated facility, which means that we are able to see patients in a safe environment. And I would ask you, if you have a health issue and you are within the area, please feel free to come and consult us. We're happy to work with you and identify your issue and resolve it.
We are open every Monday to Friday from 8 a.m. to 7 p.m. and every Saturday from 8 a.m. to 5 p.m.
You come and support us in this medical clinic in Karen, in the Well. We are in the first floor. And you just test us. Sisters of Mercy are known for quality because they are all over the world, and especially our care for the sick. It is hard times because of the coronavirus, but we know we will give the best quality.
We just want to welcome all of you to come to our gynae clinic. It runs every Tuesday from 9 to midday. We have the full gynae specialty, all located in one room, one roof. We have a very comprehensive lab. We have ultrasound services, and most of all, we have caring staff who are going to take care of all your needs. So once again, welcome and karibu to this great medical center of ours.
Hello dear viewer, welcome back to our health talk. My name is Maureen Kimani as we continue to engage ourselves in this conversation about prostate cancer. And in the studio we have Dr. Joyce Chege from Mater Misericordia Hospital. She is the general surgery resident, and we shall be getting to know much more better because we know some of you are asking yourselves some questions. Is it true about the race, the black and the whites are more, the black are more at higher risk of getting prostate cancer? Well, worry not, because we shall be getting deeper information about this. Welcome, doctor.
Thank you very much,
yes. Now, tell us, what percentage of prostate cancer diagnoses are made early?
So I'll begin with the West. In the US, it's been shown that around 90% of prostate cancer is diagnosed at an early stage. And this is because of their health systems are more robust, and also their health seeking behavior is more advanced than here. So in Kenya, however, or in East Africa, these numbers are a bit lower. It's around 40%. And this also affects treatment later on and survival rates. So in the States, as I said, 90% are picked early, and their 5-year survival rate. That means after 5 years of being diagnosed, around 80% of these patients survive. Yes? Unlike in our setup, whereby 40% are picked early, but around the survival rate of prostate cancer in 5 years is around 10%, which is a big difference. Yeah, as I will talk about later on, prostate cancer is curable once it is diagnosed early. So once it's diagnosed early, you can perform various treatment measures that can aid in completely curing the patient from the cancer. However, when it's caught later on, that's when you're treating more of the symptoms than curing the disease. Yeah. So that's why it's very important to identify this cancer early, so that the patient can get the best treatment, which is cure at the end of the day. And as I had said earlier, when we had talked about symptoms of prostate cancer, we had said majority of them are asymptomatic, meaning they don't have symptoms. So how can someone know that they have prostate cancer if majority are asymptomatic at an early age? And it will come later on when you're talking about screening, about the importance of having health checkups, especially as a man, and especially as a black man over the age of 40 years. So it's very important to have regular prostate checkups, just to ensure that if you have the disease, that it's identified early, so that you can have the benefit of cure later on. Yes, yeah.
Okay, does that mean if maybe a man is at the age of 35, you cannot go for checkup or for screening of the prostate cancer because you're not at higher risk of being exposed to getting prostate cancer?
Yeah, so that's a good point. So I go back again to the question we had talked about, risk factors for prostate cancer. So as we said, the risk factors are the aging male, so a male older than 40 years, a black man, so your ethnicity, if you're black African or black American, and also your family history, so if you have a family history of prostate cancer or not. So these various factors are what will determine the age at which we begin screening for prostate cancer. So around 35 years, although it's very unlikely that prostate cancer can occur in this age, it's still possible. However, we advise from the age of 40 that screening to begin. So usually we don't advise for a young man to go for screening for prostate cancer. Yes, right. It's not necessary. Okay. Yeah.
And how is?
But that's not to say. Sorry to interrupt. That's not to say if you don't have symptoms that you stay at home. You should still go to your doctor, and from there he'll make a individualized assessment on whether to proceed or not.
Okay. Yeah. And thank you for that clarification. How is prostate cancer treated?
So treatment, the objective of treatment is divided into two. So there's curative intent and then there's to relieve symptoms. So as I had said, you remember we talked about diagnosis, whereby we got a specimen that we took to this doctor called a pathologist. Then he evaluated whether your prostate gland has cancer or not. So once he identified that you have cancer, he'll grade it and we'll say whether your disease is aggressive or it's slow growing. So once we categorize patients into these two groups, whether they are slow growing cancers or fast growing cancers, this will determine the method of treatment. So patients who have a slow growing cancer, we tend to say they are very low risk and low risk cancer. That means that the cancer grows so slowly that the risk of spreading to either outside of the prostate or to other regions of the body, as we had discussed earlier, that's the bones, the lungs, the brain, is lower than those with a higher or more aggressive disease. So for these patients, usually what the doctor will do is something we say active surveillance or watchful waiting. Basically, depending on your age, they'll follow you up for a specific period of time without any intervention, that is any surgery done or hormone treatment done. However, if your cancer type is the more aggressive type, which we say is high risk or very high risk, that's when the physician will be, or the doctor will be inclined to give you more aggressive treatment, yeah? And the treatment here is usually surgery. And the surgery is whereby you remove the entire prostate gland, yeah? And this is done through various methods. I don't think I'll go through the nitty-gritties of it, but basically, yeah. So it's called a prostatectomy, which is basically removal of the prostate gland, yeah. So once this is done, after that you can receive other treatment methods like chemotherapy, which are cancer drugs. You can also receive radiotherapy, and also you can receive hormone treatment. Because as we keep saying that prostate cancer is influenced a lot by hormones. So you're given drugs that inhibit these hormones that enable the prostate gland to grow. Yeah. So all these treatment plans are based, however, on how aggressive or slow growing your cancer is. But Maureen, I think it's important for me to say, for example, if Minor and Njoroge present to the clinic, both of whom have prostate cancer, I won't treat them the same way. It's a very individualized treatment, yeah? So what may be good for him may not be good for him. And the reason for this, it depends on the life expectancy of the patient. For example, if Minor is 40 and Njoroge is 70, I won't give them the same treatment plan. Also, the other illnesses that the patient may have, for example, diabetes, hypertension, heart disease, all this will influence the type of treatment that we will offer the patient. Also, if the man desires to have children later on, the treatment plan will also be different for this patient compared to someone who's already fulfilled their family size. So prostate cancer treatment is very individualized. I was giving you just a brief overview of what we generally do. But just because you're diagnosed with prostate cancer doesn't mean you will receive all these treatment methods. You'll have to sit down with your doctor and discuss what is best suited for you, depending on your life expectancy, how old you are, if you have other illnesses that may affect your treatment, and if you desire to have a family later on. So all these things affect how we go about choosing the type of treatment that we want. Yeah.
Okay, and in terms of the treatment, are there any side effects?
Yes, there are numerous side effects that are there.
Because you talked, it depends with a person or a patient.
Yeah.
Maybe he or he might be suffering maybe diabetes.
Yeah.
What about that in a certain case?
So the side effects are just how your body tolerates drugs such as chemotherapy and radiotherapy. Some people are not physically fit to tolerate all those medication, unlike other people. Another common side effect is erectile dysfunction that may occur as a result of this treatment. But however, there are some surgical options that are present to try and prevent a patient from getting some of these complications. That's why I think I was trying to emphasize that it's very individualized, yeah. So, and also it depends on the quality of life that we want to give the patient. Yeah.
Okay.
Yeah.
Is there any survival rates of any patient who has been diagnosed with prostate cancer?
Yeah. So I think also something else I want to add about treatment is most of these treatment methods are available locally within Kenya. We've really gone far in terms of how well we are treating prostate cancer, how well we are diagnosing the patients and following them up. And treatment of this cancer is usually done by a team, yeah? So you'll have the urologist who usually runs, is usually the team leader, and a urologist is a doctor who's in charge of the urinary system. So from the kidneys all the way down. We have the oncologist who's a cancer doctor, and we have the nurses, amongst other people. But these three people usually form the core team in treatment of prostate cancer. We have the counselor, the nutritionist, and so on. So this treatment is usually done by a team of people. It's not done by one person. And most of these methods of treatment are available locally. I think it's important to tell our viewers that they won't have to go outside of the country to seek treatment. Most of them are available within the country. So in terms of survival rates, with that said, keeping in mind that most of the treatment is available locally, survival rates have improved within the country because, of course, the treatment methods are available. And what we need to encourage people is we want to catch this disease early because it's a curable disease once it's identified early. So the goal is, again, I can't say this enough, if you're above 40, have a regular checkup done by a doctor so that you can get it, especially if it's asymptomatic. If you present with symptoms, visit the doctor who will evaluate you for this disease or not. So this helps to improve survival rates and the outcomes tend to be much better once the disease is caught early, yeah. Because once it spreads to the back, to the brain, there tends to be quite a bit of suffering during that time, but once it's caught early, there's a lot that can be done, either to cure the cancer or to manage the symptoms so that the patient can have a good quality of life.
Okay,
yeah.
And if a person is diagnosed with prostate cancer, is there any specific type of diet they're supposed to follow?
There's no specific diet. As I had said earlier, there are just ways in which to manage your prostate health. So if you're a smoker, we encourage you to stop smoking. Just manage your alcohol intake. There's some foods like tomatoes, again, watermelons, that will help improve your prostate health. We usually say what's good for your heart is good for your prostate. So you use that same analogy. Yeah? Red meat has also been shown to increase your risk of prostate cancer. So maybe reducing your intake of red meat. Yeah. So those are the things I think that have been shown to improve your prostate health.
Okay, talking about the tomatoes, there's a myth that says men, they do love nyama choma a lot.
Yeah.
So it's very important for them to add kachumbari because the tomatoes are there. It will help them to reduce, the prostate cancer.
Yeah.
Is it true? Or
so you mean the fact that I'm taking the nyama choma and then I eat and the tomatoes is helping my friend? Again, everything in moderation. I think the message that we're trying to convey is that you shouldn't eat nyama choma every day. Just reduce your intake of red meat. and increase your intake of tomato-based products. But just because you are eating this way doesn't mean that you will not get prostate cancer. So I think what we're trying to say is everything in moderation. Yeah, I think that's a message we're trying to put across.
All right, thank you for that. And now let's talk about the screening, because we are encouraging the men at the age of 40 and above to go for the screening of the prostate cancer.
Yes.
Tell us, why is it important? And Mater Misericordia Hospital, do you have a screening for the prostate cancer, and maybe when you can tell our viewer?
Okay, so screening is important because it helps identify early prostate cancer. When we talked about the symptoms and the signs of prostate cancer, we said majority of patients are asymptomatic. So the only way we as doctors can pick up that the patient has prostate cancer is through these screening exercises. However, not everyone should be screened. That it should be tailored to certain people, and that's people who have a family history of prostate cancer, the older men, and the Black African or Black American individuals. So for these people, the screening will tend to be a bit younger, which is 40 years. However, if you're Caucasian, you're white, you're Hispanic, or you're Asia, the screening can be much later at around 50 years of age. And this, by screening, it doesn't mean that when you present yourself to the doctor, he'll perform all the tests that I had said before. So you sit down with your doctor, a history is taken, and then from there he evaluates whether you need to have the various tests done. So once, for example, the PSA is done, for example, if it's going to be done for the patient, they'll have a follow-up visit that they'll be coming. So either every year or every 2 years, depending on the baseline level that was found. So after that, it's important that you comply to these rules. If you're told come back after 1 year, come back after 1 year. If it's 2 years, come back after 2 years, so that you can be able to pick these things early. Because we said once it's picked early, it can be cured. Yeah, but once it spreads, management tends to be different. Yeah. Within our hospital, Mater, we conduct yearly screening programs for prostate cancer. This year it will be on the 6th of November at our main hospital, which is in South B, and we encourage everyone to come, and from there we shall evaluate you. Yeah, so encourage your brothers, your husbands, your fathers who are 40 and above, to come for the screening.
Okay, thank you so much, Dr. Joyce, for that informative session with you. I'm sure our viewers have been able to enjoy and to learn more about prostate cancer, and they will turn up for the screening, definitely. Okay. Maybe we can share the contact for the main hospital, or maybe a person wants to visit the main hospital for a checkup or any other follow-up. So the one can walk in. We usually have a Wellman's clinic that runs daily from Monday to Friday, 9 to 5 p.m. Just present yourself to the casualty, and we will direct you on where you can go. Okay.
Yeah.
Thank you so much, Dr. Chege, for coming here
Thank you for having me.
to help our viewers to learn about prostate cancer. We have really enjoyed, and may God bless Mater Misericordia Hospital and all the staff, the doctors, for the good work that you're doing, and wishing all the very best.
Thank you.
Okay, thank you so much. That is Dr. Joyce Chege from Mater Misericordia Hospital. She is the general surgery resident. I hope you have learned a lot about the prostate cancer. See you next time. My name is Maureen Kimani. Have a blessed day.
Capuchin TV, your Catholic broadcast.